Hey guys, what's up? It's me, Professor D. Okay, guys, I have another legal ethics question for you. Okay, so the question is, what is the primary role of the nurse when obtaining informed consent? 1, witnessing the client's signature. 2, explaining the risks and benefits of the procedure. 3, documenting that the client's significant other agrees to the procedure. Or 4, answering any questions that the client may have. And I'll ask you the question again. What is the primary role of the nurse when obtaining informed consent? 1, witnessing the client's signature. 2, explain the risk and benefits of the procedure. 3, documenting that the client's significant other agrees to the procedure. Or 4, answering any questions that the client may have. And the correct answer, guys, is number 1, witnessing. That is the nurse's job, okay? Now, when it comes to NCLEX, when it comes to HESI, when it comes to ATI, when it comes to any of these tests, they're testing your understanding, your nursing understanding. I know as students, you want to answer questions, but guess what? That is not your job. As a nurse, your job is to be present when that patient says, yes, I understand. Your job is to witness them sign, and you take that signature and you put in patient's chart. That is your job. Let me tell you something. They'll try to trick you. You'll see a situation where the patient said that they understood, they signed, and as you go to put the chart, as you go to put the signature in the chart, you notice that the patient was medicated for surgery. They were given an opioid before they signed. Guess what, guys? That signature is null and void. You're going to have to call the physician and let them know that surgery is going to be canceled. They're going to try to trick you. They're going to give you a situation where, the surgeon explained the procedure. Because remember, that's the surgeon's job. That's not your job. The surgeon explained the procedure. Patient said they understood. Patient even signed. While the patient's signing, the doctor gets an emergency. He's beeped right away. He has to go save someone's life, and he leaves the door. And as soon as he leaves, the patient says, oh, well, you know what? I really didn't understand whatever aspect of the procedure that they don't understand. And the question they're going to ask you, what are you going to do? And as a student, I know you're so scared to choose the one that says you call that surgeon, you call the doctor to come back in, but that's the correct answer. Don't be fooled. I don't care what kind of emergency they tell you is going on. That doctor is going to have to come back and explain the procedure, because it's not informed consent until the patient truly understands everything and they have no questions. If they have a question, it's not your job to answer. You have to get that surgeon back in the doors, okay? You don't answer questions about the risk and benefits of the procedure. You don't answer questions about what may happen during the procedure. You don't answer questions about what may possibly happen to them if they don't get it done. That's not your job. Your job is to make sure that they understand the procedure. They were not under any influence. They were not premedicated. They were not any influence when they signed, and it's just to witness and put in the chart. That's it. Anything other than that, it's out of your scope of practice. Make sure you know it, because they love putting these types of questions on the tests, okay?